This is part 2 of our session on hepatitis A. In this video, we are going to be talking about the symptoms, risk factors, treatment, and prevention of hepatitis A. Stay tuned.
What are the symptoms of hepatitis A?
The incubation period of hepatitis A is usually 14 to 28 days, and the symptoms of hepatitis A ranges from mild to severe and can include fever, malaise, loss of appetite, diarrhea, nausea, abdominal comfort, dark-colored urine, and jaundice, that is, a yellowing of the eyes and the skin. And we have to note that not everyone who is infected will have all these symptoms. And also, adults have signs and symptoms of illness more often than children.
Who are those at risk of hepatitis A, and how is it contracted?
Talking about those who are at risk of contracting hepatitis A, anyone who has not been vaccinated or previously infected can get infected with the hepatitis A virus. And in areas where the virus is widespread, that is high endemicity, most hepatitis A infections occur during early childhood, and the risk factors include poor sanitation, lack of safe water, living in a household with an infected person, being a sexual partner of someone who has acute hepatitis A infection, use of recreational drugs, sex between men, and traveling to areas of high endemicity without being immunized.
How can hepatitis A be treated?
There is no specific treatment for hepatitis A, so recovery from symptoms following infections may be slow and can take several weeks or months. It is important to avoid unnecessary medications that can adversely affect the liver, for example, acetaminophen and paracetamol. It is also important to note that hospitalization is unnecessary in the absence of acute liver failure, and therapy is aimed at maintaining comfort and adequate nutritional balance, including replacement of fluids that are lost from vomiting and diarrhea.
How can hepatitis A be prevented?
Improved sanitation, food safety, and immunization are the most effective ways to combat or prevent hepatitis A. The spread of hepatitis A can be reduced by adequate supplies of safe drinking water, proper disposal of sewage within communities, and personal hygiene practices such as regular hand washing before meals and after going to the bathroom.